Welcome to Mindscapes from Live Oak Studio at Texas State University, where we explore how design shapes our mental emotion and lives. I'm your host, Nadim Adi, professor of interior design at Texas State University. And today I'm joined with Sana Adi, who is the engagement director at Mint Memory Clinic and vice president of business development at Plumtree Memory Care. And she joined us all the way from Canada. So welcome, welcome.
Thank you for having me.
Yeah. Senna, tell us a little bit about your background and what brought you to this field and this role.
Sure. So, my background bridges health systems and community based dementia care. So, a little bit about the organizations I work for. Plumtree Memory Care is a memory clinic that offers diagnostic services to anyone in need of mental health supports, memory supports in Ontario. And Mint Memory Clinic is a not for profit organization that's focused on training for primary care physicians, pharmacists, occupational therapists, really anyone in the allied healthcare space to be able to manage and diagnose dementia in primary care. So, really, it's all about bringing together all these different diagnostic services with a really comprehensive and compassionate lens, just to really help support therapeutic approaches across all different communities and make healthcare more accessible to people.
Oh wow, that's fantastic. I love the accessibility angle because we don't
Mhm.
get enough of that. Neither here
Yeah,
nor there, I think. Yeah.
yeah, yeah,
Uh,
definitely.
yeah. So how has mental health or emotional well-being influenced the way you think about your work or the environment we live in?
For sure. So, definitely a lot of the therapeutic considerations, both for Mid Memory Clinic when we're doing our training in primary care, but also at Plumtree when we actually have a brick and mortar clinic space for patients to come to, really comes down to making patients feel comfortable and that they can really be open and vulnerable with a lot of their concerns. Things like a dementia diagnosis can be very stressful. It can be very anxiety inducing, not just for the patient, but also for their families and their care partners. So, we want to focus on training healthcare providers on how to deliver a calm environment to help reduce some of the anxiety and confusion and agitation, especially as people progress along with this neurodegenerative disorder. Also, we really want to make sure that it's a very familiar space. We want to focus on relational safety between patients and community partners where we link them at the clinic. So, definitely lots of focus on making the spaces feel accessible, but also functional for our healthcare staff at the same time.
I love this when you mention accessible yet functional. This
Mhm.
is something that I think every designer kind of struggles with, but it's
Yeah,
usually it has to look pretty, but it has to be functional as well.
exactly,
Yeah,
exactly.
yeah. Um, but also something you touched on when you mentioned that when somebody is usually diagnosed with dementia or Alzheimer's,
Mhm,
it's
mhm.
stressful for them, but it's stress for a lot of stress for the family or the carers
Yep.
as well. So, can you kind of expand a little bit on that point?
Absolutely. So I'm going to focus a little bit on the Mid Memory Clinic model because
Yeah.
this is ultimately the award winning model. It's won countless international awards in its
Mhm.
approach because it's very unique. Part of what makes it so unique is that it not only is focused on diagnosing the patient, it
Mhm.
also trains healthcare providers in primary care how to screen capacity and mental health care
Mhm.
for care partners who are coming in. Because part of the diagnostic requirements in primary care is that history collection for the patient. They're not always able to give that patient history, the medical history.
Mhm.
Either they're not aware of it or they're not noticing the changes that are happening in their memory. And so this is where we're also requiring that a care partner comes in. But
Mhm.
with that, we need to make sure the space is accommodating them. So when we interview the care partners to understand better what their capacity is to help avoid burnout, which ultimately leads to crisis events for the
Mm.
patient. We want to make sure that that space is just as calming and accessible. No one really wants to walk into a sterile, hospital
Fair
anxiety
enough.
inducing
Fair enough.
environment with the
Yeah.
fluorescent lightings.
Yeah.
Sometimes that is necessary in certain medical spaces, but when you're trying
Yeah.
to interview a care partner in terms of understanding home safety, for example, or their
Hmm.
capacity to help the patient manage their medication intake,
Hmm.
we want to kind of bring down the anxiety a little bit and make it feel a little bit
Fair
more
enough.
therapeutic and supportive.
Oh, fair enough. And from your experience, what was the kind of aha moment where you thought, okay, well, design is can be a real factor in terms of making the quality of life of that person or the caretaker better.
Mhm. Great question. So, I think, again, the strength of the memory clinic model is that it's an interprofessional model. So,
Mhm.
when we're just focused on one healthcare specialty, we
Mhm.
might overlook some of the strengths of the other specialties. And the fact that we incorporate social workers into
Mhm.
our diagnostic approach makes it so that they're able to sort of bring that little gentler approach where I've seen some of these offices that they set up and how they train other social workers to set up their offices.
Mhm.
They're so beautiful, they're so relaxing. And
Mhm.
why can't we incorporate that into primary care when we're performing an assessment for Parkinson's or dementia,
Mhm.
especially again, as we're involving the family members as well?
Yeah, and what was like from your perspective, what type of spaces you already mentioned one of the types of spaces that might not work, which is the very sterile and fluorescent lighting spaces. But what kind of spaces do you think are more supportive of the mental health of a person?
Okay, great question. And I hope I can answer it because my background is primarily in public policy and economics, not quite I think I would have a better answer if I was one of the OTs or the social workers in our clinic. But I will say two things come to mind for me. One is that, again, it's when we're trying to make a space focused on mental health, we're
Mhm.
keeping the clinical components that are required for an assessment to a minimum in terms of like we don't have any scary tongs or anything hanging around the office like whoa, as soon as somebody walks in they see something that really ups their anxiety. We want to make sure that whatever is needed for our healthcare practitioners
Mhm.
to perform their diagnostic assessment, they have those tools and nothing extra. And then at the same time, from like an OT perspective, how can we make sure that the space is easily navigable by somebody who's been diagnosed with dementia at any stage of the disorder? So anywhere from mild cognitive impairment, where they may be able to navigate pretty comfortably, all the way to dementia that's further along, where they may have mobility issues, they may need mobility devices when they
Mhm.
come into the clinic. We want to be able to balance, the space requirements for that, for the
Yeah.
diagnostic support, for the mobility aids, and for also having the space to ensure that it's not a cramped room if we're bringing in a care partner, because
Yeah.
part of it is bringing in the care partner to help with that history taking. But
Yeah.
if the space is set up so that they don't fit, that's not great. I will also add that
Mhm.
because our model, the core of the mid memory clinic model is to try to spread dementia care access anywhere in Canada and internationally. So, a
Mhm.
lot of times, especially in Canada, many of these clinics have been trained in remote and rural communities. They often
Oh.
struggle with
Mhm.
these. We don't want to be too prescriptive with the space requirements and saying, you must have this many rooms and you must have these things because then that limits the accessibility. There have
Mhm.
been mint clinics that have been set up in church basements or in conference rooms. Whatever is
Mhm.
ultimately required, we also do have to work with the limitations that we have because we're
Yeah.
balancing, the ideal of what it could look like in a multi-million dollar facility that's funded, but
Mhm.
also sometimes it could just be in a very rural area that doesn't have a hospital access that's easily accessible. So we're going to set up where we're able to just to ensure that people are able to get the care they need.
Oh, that's fantastic. And I love the point that in some cases the challenges are even more of do we have a doctor in that
Exactly.
community or how many times a
Exactly.
month or so they can come there. And
Yep.
another thing I think, and I think we've got about a minute or so, but one thing is do you sometimes face a bit of resistance because on my end, like growing up, I knew that mental health was something you never mentioned. You could
Mhm.
mention someone has, any other disease, but nothing to do with mental health. So
Yeah.
was that something you find like you deal with, because you're boots on the ground, really? So.
Yeah, yeah, absolutely. I think it's obviously stigmatized. Anything to do with mental health is
Mhm.
oftentimes stigmatized, both for the patient who may be experiencing memory disorder or also their care partner who may be overworked and stressed. So I'll start with the patient piece.
Mhm.
Uh, Many times when you start by asking, do you have a memory issues or memory concerns that you're coming here for? The answer
Mhm.
is no. But then when you start asking additional questions like, well, how are you with your um, taking
Mhm.
medications every day? Are you remembering to take all
Mhm.
your medications appropriately? Are you able to cook for
Yeah.
yourself appropriately? Can you take
Mhm.
care of yourself? That's where the occupational
Oh,
therapist piece
right.
comes in, because
Yeah.
they're really able to get down to those, daily living
Mhm.
tasks. Are they able to
Mhm.
function normally, or do they need additional supports? And we can
Mhm.
sort of
Yeah.
pull at that string a bit. But
Oh.
then with the care partners,
Mhm.
I'll quickly just add that again, it's the same thing where you're focusing to not just on individual feelings of obligation, but also there are oftentimes cultural obligations. So
Yeah.
no one wants
Yeah.
to admit that they need additional support because of the
Mhm.
stress
Yeah.
and anxiety and guilt that comes with that. So we try
Yeah.
to focus on all of that.
Oh, fantastic. I love the insights. You're watching Mindscapes. We'll be right back. Welcome back to Mindscapes. We're continuing our conversation with Sana Adi on design and mental health. Um, was there, in your experience, Sana, was there any kind of design elements that stood out, something like light or sound or texture that really makes the biggest difference in your opinion?
So, in terms of within the clinical setting, either in primary care or at Plumtree Memory Care, our actual
Mhm.
clinical space, they're pretty standardized in terms of
Mhm.
how they're set up. But the main thing is we help support people in terms of setting up their homes to be safe. So, one of the
Mhm.
services we offer through Plumtree Memory Care is a home safety assessment. And one of the design elements, actually, two of them I'll mention, is
Mhm.
the tripping hazards. Those are huge, that the occupational therapist just always has their eyes out for that to make sure that
Mhm.
that's not a concern in the home. But also the lighting is a big one, because if you may be familiar with the term sundowning, which is just an
Mhm.
increase in agitation and confusion or anxiety with the decrease in sunlight, natural part of the circadian rhythm cycles towards the evening,
Yeah.
that can be a big concern for people. So sometimes we try to, do different light therapies and different
Yeah.
modalities of that to anchor the patient and help with maybe minimizing some of those behavioral concerns or expressions.
Wow. And from my time in Canada, I remember like, especially during those winter months, and
Oh
they
yeah,
tend to be long. So
they're
like
rough.
our access to daylight is not the best out there. But
Yeah, you don't
yeah,
need a dementia diagnosis to get a sad light. We all have
yeah,
them in the home for vitamin
yeah.
D, so highly recommend those.
Oh, okay. And what would you say is one of those things that's often overlooked when it comes to to fitting your environment for someone who's struggling with their mental health?
So again, it depends. If we're talking in the clinical setting,
Mhm.
we want to make sure that accessibility is a big factor in it. And
Mhm.
oftentimes, when there's a set standard in terms of how to apply a certain care model,
Mhm.
we often overlook the different resource capacities of different communities, rural communities, remote communities. And
Mhm.
so that's where I think Mid Memory Clinic has a strength, because it's
Mhm.
focused on ensuring that the perfection is not the enemy of the good. We want to make sure that the clinics
Yeah.
can be established. And then also, when we're talking to patients and families about integrating these design elements into the home, when you receive a diagnosis like dementia,
Mhm.
it's very difficult to change a lot of the other parts of your lifestyle. So it's such a big life altering diagnosis that to then say, okay, well, now you're no longer able to drive. and we have to get rid of the rugs in your house, and we have to change how you're
Mm.
able to cook. That can be really destabilizing for the person and the family. And so we want to make sure that this is why we incorporate occupational therapists and other healthcare specialists to come into the home or work with the family to be able to incorporate safety, but do it
Mhm.
in a way where there's buy-in, because we want to make sure that the person still feels like they're in control and they still have the capacity to make healthcare decisions for themselves to maintain that sense of dignity throughout the process.
Yeah. Oh, and I love the sense of, like you mentioned, the sense of dignity, and that's one of the more like one of those terms that pops up a lot when you're
Mm-hmm.
thinking about dementia care and all of that. Um, like, do you think that dignity and independence of a person, like, are they synonymous with each other, or is there a few tricks for, say, independence different from dignity, or vice versa?
That's a really good question. I
Mm.
think they are fairly synonymous. It's just
Mm.
the way that oftentimes the stigma doesn't come from the person themselves, it comes from the
Mm.
surrounding community. So, for
Mhm.
example, if somebody needs additional supports, it's that those supports are actually empowering that person to continue living independently. But if we
Mhm.
stigmatize the use of a walker, or we stigmatize the use of ride shares or taxis because they no longer have their license,
Mm.
we're putting that patient in a position where they feel like they're losing control of their life, where instead those are simply tools that are helping them live independently. Having Meals on Wheels come to the house, for example, that helps them
Yeah,
live independently at home longer in the community.
gotcha. And whenever you're evaluating their space of, like, where they're living, whether it's at a home or, say, an assisted living home or such, like, what are the like, what's the go-to things that you look out for?
Mm-hmm. Of
Mm.
course, the first thing is safety related. We want
Mhm.
to avoid falls because those can be catastrophic. We want
Yeah.
to avoid, anything that's really dangerous in the home,
Mhm.
and adapt it so that the person can still live independently. Again, for
Mhm.
example, instead of using an oven, maybe an air fryer is the safer approach. If the person loves to cook but might be forgetful,
Yeah.
there are different tools that can be incorporated to help support their daily activities. But also, again, it's making the home still feel comfortable and making the home still feel like an accessible, welcoming space. We want to make sure that the space invites connection with others and
Mhm.
doesn't just feel like now it's turning into a hospital room in your own house. It's that
Oh,
balance of both.
yeah, no, I love this. I love the idea of I want it to be safe, but then again, I don't want to wrap the person in bubble wrap, as we tend to do with our
Exactly.
kids sometimes, right?
Yeah, exactly.
Yeah. As you're kind of I bet you've seen quite a lot of different homes and spaces through the
Mhm.
years. What was there a specific project or a place that really inspired you in this area?
Yes, absolutely. So, recently, last week, Mid
Mhm.
Memory Clinic was invited to present in Singapore to try and expand our services there, which was a real
Mhm.
privilege to learn. And one of the things that I found really amazing was that in many of the government housing buildings, they
Mhm.
actually paint the numbers on the outside in different color codings for the different neighborhoods. And that's
Mhm.
one way that the policies are starting to be set in place to align with design requirements for aging
Mhm.
communities. And so if the person may forget, for example, the exact number of which building they're in, they can maybe follow the colors, trying to make the spaces, public spaces, more adaptable and accessible for people. I think
Mhm.
a lot of that really comes down from top-down approaches in
Mhm.
policymaking and investment. So it really does inspire me anytime I see a high-level policy that comes into place to support this type of aging initiative.
Oh, that's fantastic. And I love the idea that you mentioned color, because that's
Mm-hmm.
like, that is one of those fairly cheap interventions that you could use
Exactly.
face, right?
Yeah, for
Yeah.
sure.
So I often find myself telling people all it takes is a bucket of paint and some elbow grease and you're good to go.
There you go.
Yeah.
That's it.
Um, in terms of uh, so you mentioned policy.
Mhm.
One of the challenges on policy is having buy-in from the decision makers. So
Mhm.
what's like, how do you kind of approach that thing? Because it's a different thing when you're talking to a family member versus
Yeah.
a policymaker.
Definitely. And the big
Mhm.
challenge also with policymakers is that they're juggling many different files. And so,
Mhm.
how do you get this one voice heard amongst many other deserving voices? You know,
Mhm.
it's you're competing oftentimes for a single
Mhm.
allocation of budget for Ministry of
Mhm.
Health, for example. And I think one of the strongest pieces of advice that leads has led to our success is you have to come in with a unified voice. You have to come in as collaboratively as possible with all the other organizations and players and stakeholders in that space. So it cannot be just siloed one agency that's coming in and advocating for itself. It needs to be part of a larger
Mhm.
cohort that are all pushing forward towards the same policy. And you must incorporate people with lived experiences and their care partners as well, because it has to be across the board. It cannot just be one single siloed individual group.
Fair enough, fair enough. Well, these are fantastic insights. So we'll take a small break and we'll come back in a second. This is Mindscapes from Live Oak Studio at Texas State University. Stay with us. We'll be right back. Welcome back. We're here with Sana Adi from Mint Memory Clinic and from Plumtree Memory Care, exploring the connection between design and well-being. So, Sana, if you could change one thing about how we teach design or about how we talk about mental health, what would it be?
I think we need to really incorporate the lived experience of people living with dementia, their care partners as well, as part
Mhm.
of almost like incorporating empathy as a standard for design. If we don't, then we really miss out on a lot of the therapeutic benefits of design and other policies in place that
Mhm.
have contributions that may not be immediately measurable or may not be intuitive to practitioners. It
Mhm.
really needs to be a collaborative effort. And I think also, as well, the same as I've been mentioning before, the memory clinic approach of incorporating multiple different types of allied healthcare perspectives. The
Mhm.
strength comes from these different areas of expertise, all collectively working towards one singular goal. So it cannot just be a siloed one perspective of design because this is the clinical best practice. Okay, that's
Mhm.
great, but how do we also bring in the perspective of a social worker or a nurse or the care partner who is in a long distance caregiving situation? It has to be very collaborative, which is harder,
Fair
but I
enough.
think it
Yeah,
will
yeah.
yield better results.
Yeah. And as you mentioned, like different people have different preferences. So someone
Mm-hmm.
might say, well, I love plants. The other one might say, I cannot stand them. So
Yep.
uh,
Yep.
I
Exactly.
haven't met that person yet, but like,
In theory.
in theory, yeah, but or it might be someone like me is like, okay, I love plants, but I'm not very good at keeping them. So yeah. Right. Uh, Nowadays, like we see a lot of technologies kind of coming,
Mm-hmm.
becoming more and more popular, and
Yep.
with the speech about things like, okay, AI
Mm-hmm.
or having your, personal robot or something like that. How do you see the relationship between mental health spaces and design kind of in the future? What's your take on this?
I think there has to be a move towards integration for the different types of spaces and settings where people receive care. And by that, I mean in Ontario, for example, which is where I'm
Mhm.
based, you can categorize healthcare into three primary categories.
Mhm.
So, one is primary care, which is where Mint Memory Clinic and Plumtree Memory Care, we occupy that space.
Mhm.
Two is the specialist or hospital care. And
Mhm.
three is community care. So that's where we get personal support workers, PSWs, the different Alzheimer's Society organizations, community supports coming in. And
Mhm.
each of those has sort of a blueprint for the way that the space is designed, for the way that care is delivered, who is occupying those different spaces, and the funding that goes with all of those. So I really think that as the population in Canada and internationally continues to age,
Mm,
environments are going to have to sustain these cognitive changes. And they cannot be done in one of those spaces. It cannot just be hospitals that integrate that care and
mm,
nowhere else, or only community care and nowhere else. It
yeah.
has to be across the spectrum and also just within the general community. How can we incorporate those changes into banks and grocery stores and other public spaces?
Mm.
That's
So
how I,
kind,
I
yeah,
hope for it anyway.
yeah. So kind of like smart cities or what was the name? Sustainable communities or sustainable
Yeah,
development. Yeah.
like essential infrastructure has to be
Mm,
part of it. So
mhm.
we'll see how it goes. I hope someone smarter than me figures it out, but it'll be very interesting to
No,
see.
this is fantastic. But you mentioned that you try to include the caretaker in the
Mhm,
process when you're explaining things to them.
mhm,
Um, and we touched a little bit about the public perception of a person. So,
mhm.
where do you see the relationship going between, say, like or the role that people, everyday people or students or designers or family play in shaping healthier environments?
Mm. So we have the public wherewithal to know that, there are certain demographic changes coming. We
Mhm,
understand that populations are aging
mhm,
and there are going to be many older adults in the coming years and decades. How can we support those communities? So
mhm,
obviously, education,
mhm,
learning about that being self-taught, and not being afraid to ask questions. We
mhm.
destigmatize things by learning about them. We're afraid of things we don't understand.
Yeah.
We feel like things are too big and intimidating. These are huge policy problems. How can I contribute to that? Well, start by learning small things. How can you make it so that within the community, for example, if you have older adults or people with mobility issues or whatever the case may be coming to your home, is there a
Mhm,
way that you can make your space more accessible? If you're responsible for a clinic or a retail space, can you make that space more accessible? Can you incorporate staff training there?
mhm,
Think about how you can do that with your own part, but really a lot of it starts with destigmatizing these
mhm.
concepts initially through education.
Gotcha. And what's if someone's listening to us now and thinks, okay,
Mhm.
I want to make the space that I'm living in slightly healthier. Like, what's the
Yep.
one tip that you can tell them that they could implement right now,
Mm.
like a freebie, if you will?
A freebie.
Yeah.
Be careful with area rugs. Those
Mhm,
are often tripping hazards
mhm,
for people with mobility issues or walkers or canes. So
mhm,
just keep a mindful eye on those kinds of welcome mats and things as people navigate spaces. And also make sure things are well lit. So if you
mhm.
have grandparents visiting or your parents or you yourself, keeping little night lights around stairs, that's really helpful and goes a long way to help avoid tripping hazards.
So no kind of shaggy kind of thick rugs around.
I think we can leave that in the 70s.
Fair enough. Fair enough. Was there anything kind of you wanted to add or to like leave our viewers with?
Yeah, for sure. So
Mm,
ultimately, good dementia care, mental health care, etc.,
mm,
it's not just the diagnosis. It's also part of how we design things and not just spaces, but also systems. So
mm,
if we have pathways to care, they can't be fragmented. And it's our responsibility to really make sure that those services, especially if we're responsible for their delivery, they reflect cultural competency, community needs, ensure
mm,
that care partners are supported. They're a huge piece of this puzzle as we try to figure out how best we can support people who are aging, especially with memory disorders and cognitive disorders. Ultimately, we want to make sure that there are better outcomes for people even
mm,
before they enter the clinic. And so, policy itself, too, is
mm,
part of
mm.
design. And I really hope that, with Mint Memory Clinic and Plumtree Memory Care, we can spread that awareness internationally.
Oh, that's fantastic. And it kind of echoes when they say it takes a village to raise a child. It takes a village to kind
Exactly.
of care for each other, right?
Exactly.
All right. Well, thank you so much, Sana, for sharing
Thank
these
you.
perspectives today. I think that these conversations remind us that it it's not something like the environment we live in. It has to be satisfying to the person, but
Hmm.
it's not just about aesthetics. It's really about
Yeah,
the people, the emotion, and the memory and the well-being.
that's right.
Um, well, I want to thank you again for your time, for your effort. And we had Sana Adi from Mint Memory Clinic and Plumtree Memory Care, and she shared her insight with us today. And I want to thank our viewers for joining us here on Mindscapes, where we explore how design shapes our mental and emotional lives. Mindscapes is produced at Live Oak Studio by the School of Journalism and Mass Communication in collaboration with the School of Family and Consumer Sciences at Texas State University. I'm your host, Nadim Adi, and we'll see you again next time.